Good morning, everyone. My talk is a little bit of technology and how technology is changing things and improving compliance and adherence to therapy, which is always a challenge for all our type 2 diabetic patients. Because in the chronic disease segment, what happens is the patient has to live with the problem the entire life, prevent complications, and in case the complications are present, he needs to actually live a life with those complications and minimize the adverse events that can happen. So how do you improve adherence to therapy and see that the patient sticks to all that we say, is what I'm going to talk about in the next few minutes. Now, when you talk of adherence to therapy, the WHO clearly says adherence is the extent to which a person's behavior in either taking his medications or following the diet or the lifestyle changes that you actually advise him is how much is his compliance to all these. Is he following it from day one till the last day, till all the time that you've told him, or is he falling out? So when it comes to taking medications, it has been seen that almost 30 to 60% patients with chronic illnesses are adherent to therapy. WHO estimates also very clearly say that it's only 50% of patients in the chronic disease segment who are adherent. The remaining keep falling out, the compliance is poor. Closer at home, when you talk of diabetes, the cross-national DAWN study actually said, as far as compliance to therapy is concerned, in type 1, it is only 83% patients who follow what you are telling them. No, and that also is not 100% compliance because glucose monitoring for complications still takes a backseat. All they do is maybe take their insulin shots because they know it's important. And at times not taking insulin shots by checking your glucose is another very, very important thing. And in type 2, it's even 78%. Now, there are a lot of factors that impact adherence to therapy. Most important, of course, is the complexity of treatment because the simpler the regime, it's easier to follow. The more complicated the treatment, the more the dosing frequency, the kind of medicines you add, the kind of regimes you put on, the patient compliance always takes a backseat for complicated therapies. Again, safety, tolerability, side effects, weight gain, weight loss, hypoglycemia, all these make patients fall out. Psychological factors in terms of psychological insulin resistance, So the patient needs insulin, but of course, since it's an injectable, since they know, the basic myths related to insulin always make the patients fall out. Cost of therapy is also very important because if you're choosing a therapy which the patient can afford, of course, it's easy for him, easy on his pocket, he will follow it. If you're prescribing the wrong drug for the wrong patient and he cannot even afford it, so there's no point. He'll just walk out of with your prescription and he'll never follow it. What is very, very important is the patient and the healthcare provider interaction. So a good communication on why compliance is required, why you are advising his therapy, taking him into confidence is going to improve his adherence rates. Again, the information that the patient gets, the awareness and education and empowerment are very, very important in improving adherence. These are some of the studies that I came across. This is a study from Nagpur, so very, very closer to home, which actually looked at non-adherence. And what they found was, of course, the cost of medicine is something very important, but besides that, the most important thing that led to non-adherence was patients were not even aware of why a medicine was being prescribed to them. And forgetfulness, they keep forgetting, even if they want to take it, but they don't remember the regime that you've told them. Little perception of the need for medicine, the complications it can cause if they're not taking medicines, and of course, a lot of other factors. This is where technology has stepped in to improve compliance, to improve adherence, and a simple smartphone that all of us carry has become our lifeline, not only in making calls and clicking pictures, but in so many medical things. When you talk of diabetes, right from diagnosis of diabetes and its complications to monitoring for glycemic control, management, therapeutic, educational, as well as patient engagement and management of data. Everything is centered around technology today, which we all use in our day-to-day clinic practice as well. This is a paper that actually looked at various different technological means and how this artificial intelligence is improving diabetes care. And as you can see, greater accuracy, better efficiency, ease of use, better patient satisfaction, and of course, good quality of life. When it comes to different technologies, point-of-care technology has really changed life for a lot of patients. Point-of-care means you don't have to send the patient to the lab, you don't need extra staff, you don't even need to set up a lab. You have simple devices which immediately give you immediate results in real time. So this improves compliance. Not only does it have operational benefits because you need less staff, Clinical benefits, because the results are there immediately, which motivates the patient. You can immediately change therapy, lower the HbA1c levels, and of course, it improves compliance. So you have the HbA1c point of care kits, simple glucometers that we use is point of care for glucose monitoring. You have ketone strips. So all these things have made life very easily. The patient doesn't really have to give a blood sample and wait for the report to come in the evening. These point of care technologies, of course, go a long way in improving adherence and compliance to therapy. A simple smartphone today comes equipped with so many different apps, different things. An iPhone, you can measure your pulse rate, you can see your ECG, SpO2 can be measured, the torch can be used to examine anything. You don't need to keep a bulky torch in your clinic anymore. You can transmit data, you can click a picture, and through telemedicine, you can get an opinion from any of your super specialist colleagues anywhere regarding a patient that you want to take a decision. You can live stream things through a video call. So the phone is no more a tool to make phone calls. The technology can improve patient outcome, it can help the patient and improve adherence. Something as simple as screening for complications of diabetes. Today we have all these fundus on phone kind of devices wherein all you need to do is a handheld retina screening that can be held even in a mobile van. You just go with your van, you just have this is the Shalini Eye Examiner system. You mount your smartphone and you take pictures. This is what we use at our center. So all you need to do is have a trained optometrist or an eye technician who can just click images on the equipment, transmit it to the cell phone, and through the cell phone, you can just send it to the retina specialist and get an opinion on what kind of findings you are getting, and you can yourself look at it and convince the patient that this is how the complication is setting in and how this is progressing. These are some of the validation papers that actually talk about this. Again, for neuropathy, some simple technological tests measuring an ABI in your lab, foot pressure study for prevention of diabetic foot ulcers, all these things which are handy, come immediately with immediate results, really help in improving compliance and adherence to therapy. When it comes to glucose monitoring technologies, like I said, gone are the days when the patient had to go fasting to the lab, give a blood sample, the report would come in the evening, next day he's going to come, he gets busy, he doesn't even come. And he would come with a glucose report that he'd done maybe a month back and did not get time to seek your appointment. Simple glucometers, immediately you're getting results, you're actually changing doses, so the compliance improves. And now in the era of continuous glucose monitoring with flash glucose monitoring, you have a complete 24/7 overview which actually opens the patient's eyes and he can see how his treatment is working for him. These are the different data that actually look at all this, and all of them very clearly said that all these improvements to glucometers, now you can actually transmit the data through the glucometers directly by infrared technology, by NFC, to the computer, to the laptop, and if you're on the same, the same app, your doctor can actually monitor your glucose levels and access your reports without you actually going to the doctor. So this is how things are changing and adherence is improving. We have an entire session on continuous glucose monitoring, so I will not spend much time on this. Of course, flash glucose monitoring system, the AGP, has changed life for everybody. And you know that all you need to do is put a sensor, and for 15 days, it is going to record every 15 minutes the interstitial glucose levels and give you an exact overview of the glycemic control for the patient. Once you show this to the patient, you can actually discuss what are the problem areas, where are the hypoglycemias happening, how uncontrolled are the sugars, where are the peaks, where are the valleys, and change treatment, which actually makes him understand what you are telling him and of course improves adherence and compliance. The Eversense CGM is again an implantable CGM that stays for 90 days, already approved by the US FDA. Maybe it will come to India quite soon, and this is going to be a game changer as far as continuous glucose monitoring is concerned, because then all you need to do is, with a small sensor implanted in the arm, you are getting continuous glucose readings in real time transmitted to the phone for 90 continuous days, and this is really a game changer as far as compliance and adherence is concerned. Again, the Dexcom does exactly the same. the patient wears the sensor and the data in real time is transmitted to his cell phone. So all the patient has to do is look at the cell phone and he gets the trends as to whether the glucose levels are going up or coming down, or if he's getting a hypo, and he gets his real-time glucose readings, which definitely is a game changer as far as adherence to therapy is concerned. The Guardian Connect system does exactly the same with the sensor. So all these things are improving life, making things very, very easy for everybody to look at, and improving adherence. When it comes to insulin delivery, again, gone are the days when a patient had to actually take his insulin from a vial and inject with injections. Pens made life very easy for all our patients who were on insulin. And now we've progressed to pumps and the artificial pancreas. Dr. Sahai will be talking about artificial pancreas. So technology has actually changed things. Very soon we are going to have the inhaled insulin available to us, and everyone's dream, the oral insulin, which may see light of the day someday, or the insulin patches, the glucose patches. So a lot of technological things which are going to improve adherence for all our patients. InPen is already in use in the US. What this pen is, it is not only a device for insulin injection. What it does is, through Bluetooth technology, it actually transmits data to the cell phone. So all the patient has to do is sync it with the cell phone, and with Bluetooth technology, it tells him what was the insulin dose that he took last, even if he doesn't remember how much insulin he had taken, what time did he take his insulin, how much insulin is on board. So definitely all these things improve adherence when it comes to patients on insulin. The NovoPen is also on an upgrade, and the NovoPen 5 version is available in the US. India, we're still having NovoPen 4, so maybe this will come very soon. Again, this is something that keeps all the record of your dose volume and the last dose for the last 12 hours, which does help the patient remember what time did he inject, how much insulin did he inject. So all those compliance issues and the forgetfulness taken care of. The journey of insulin pumps, I think all of us are now very well aware of what the insulin pumps are all about. They started simply as insulin delivery devices, but now with so much technological advances, we have the 640G and now even the 670G mini-med pump, which actually comes with a SmartGuard technology. Now these are sensor augmented pumps, and what they do is the patient wears a sensor on the one side, as you can see here. Do I have a pointer? Yeah. So the patient wears a sensor which is actually transmitting data to the pump, and through algorithms, the patient, you can get exact real-time glucose readings on the screen of your pump, so he knows that this is his current reading, and he also gets an arrow whether the glucose levels are rising and you need to increase the dose, or the glucose levels are falling and you're anticipating a hypoglycemia. The SmartGuard technology actually makes things easy because you set an alarm and you set a level. So if the glucose levels are showing a downward trend, half an hour before the patient goes into an actual hypoglycemia, what happens is it switches off insulin delivery and gives alarms. So even if the patient is sleeping and there is a trend that he may go into a nocturnal hypo, it is going to shut down insulin delivery and vibrate and give an alarm so that he can wake up and he can take a correction for that immediately. So this is how life improves. Again, the Omnipod pump is again a very small patch pump. All the patient has to do is wear this patch, load this with insulin once it finishes, and this is all synced into almost a device, a handheld device like a mobile phone, and everything you can just govern through that. So all you need to do is control the insulin delivery through a handheld device, making life very easy for type 1 diabetics as well. The future, of course, is artificial pancreas, which Dr. Sahai will be talking about, so I won't discuss that. This is today the era of mobile health. Now, mobile health is not only your smartphones, but any device for communication which can be used as a patient monitoring device, as a tablet, personal digital assistants, or wireless devices that can be part of this entire ecosystem. So you have a lot of mobile apps which all of us are using. They monitor your physical activity, your step counts, they store all data from your SMBG values, they show your medicine adherence, whether you've taken your dose or not, and in fact you now have insulin dose calculators. So if you look at any of the apps, the Androids, the iPhones, you have a plethora of all these different apps which you can use. You can advise to your patients based on their requirement. So this is like one of those examples, the Dexcom G5 mobile app, Life in Control mobile app, different apps available suiting your patient need, which puts the patient on one side, the doctor on one side, and you have the coaches who are actually providing personalized care to the patients, personalized advice, sending reminders to their smartphones. Every day you get an SMS like the previous speaker talked about. So all these devices, all these reminders actually tell your patient, make him adherent to therapy, keep reminding him on what he needs to do, and of course, life changes. This is a paper from our own Dr. Mohan's group, which talks about mobile health technology in prevention management of type 2 diabetes. This was the study the previous speaker talked about, Dr. Ramachandran's group, where they actually said that sending text messages, using all these technologies, helps not only in reducing HbA1c, but improved adherence to therapy, improved compliance to therapy. This is another paper that actually looked at the same mobile health systems and talked about a significant reduction in A1C for all type 2 diabetic patients who actually were using all these different mobile health applications. Today, all these health educational aids, the smart wearable devices, so many of us wear smart watches. So these watches actually give you reminders, Suppose you've set a daily step count of 10,000 steps. So, you've done 8,000, it gives you a reminder, 2,000 steps more and you're on target. So that's a very motivational tool, because then the patient can monitor and he knows, okay, let me do that extra 500 steps and reach today's goal. And that is what improves compliance, improves adherence, and in the end, gives you a better A1C, better glycemic control, less complications, less morbidity. Augmented reality is again something which is seeing the light of the day. This is a technology that mixes virtual images with the real world. Can be used for a lot of things. This is an augmented reality game that in the US was used for diabetic children for therapeutic education. And what this showed was a lot of compliance to therapy, because they can actually see the 3D movie with these glasses and get motivated. Now, for example, this is another technology wherein, all the patient has to do is wear the glasses and focus on the pill. So the moment he sees this, through the internet, it takes him to a YouTube video, which actually tells him instantly everything about the drug through his technology advice. Through a pad, he can just scan and get entire information on how to take the drug, what are the side effects, what are the interactions. So it opens the doors for everybody to actually look. And social media, of course. Today is not the time where you're dependent on one patient communicating to the other on so many different things. Every other day you have a patient who comes to you and says, "Doctor, I saw this on Facebook. What is this chip? What is AGP? What is LibrePro? What is a pump?" So social media today has entered our lives so majorly that everything related to our treatment, our therapy, our disease is available on the internet. Yes, you have to be wise enough to understand what exactly is the right information and what is false information, and differentiate and use that for your advantage. This is again a very recent paper that looked at different interventions that were designed to improve the quality and efficiency of medication use in care, and all of them actually said that use of all these information technologies improves compliance, improves results, brings down your HbA1c. So this was a very important paper that actually asked these questions. Does digital health technology improve medical adherence actually? I mean, what we're anticipating, is it really doing that? And what are the benefits and barriers of medication adherence which were implemented in adults from type 2 diabetes? So they looked at telehealth, they looked at mobile health, they looked at e-health. So the entire digital platform of health, all these apps, all these different things, and how they were improving. What they said was, all these different technologies were definitely making a change to patients' lives. The HbA1cs were coming down, the monitoring was better, the compliance to therapy was better, because if you're monitoring your glucose levels and you discover that the glucose levels are not controlled, you will maybe schedule an appointment with your doctor a little earlier. If you're just going to the lab once in 2 months and doing your glucose values, you would not even know whether your glucose levels are high or your glucose levels are low. So simply having a glucometer at home, checking your glucose level a little more often improves compliance, improves adherence. So friends, I would like to end my talk with two very important quotes that I discovered. One by the man himself, Steve Jobs, who said, "I think the biggest innovations of the 21st century will be an intersection of biology and technology. It's the beginning of a new era where technology handholds your patient and walks him through his entire lifetime journey of diabetes. And medical science has proven time and again that when the resources are provided, great progress in the treatment, cure, and prevention of disease can occur. Thank you.